I'm a nurse practitioner. I started in the nursing profession in 1974 is when I graduated. I actually started in the healthcare field about 1971. In high school, I worked for a veterinarian, and that was kind of how my interest in the healthcare profession started. And then I went to work in the local hospital in Las Cruces, New Mexico as an orderly in the operating room. So from that, I applied to a nursing program in El Paso, Texas, and went to school down there for a couple of years. And I worked in the psych ward for a couple of years while I was there. And then when I got out of school, I went to work in an operating room and recovery room for about 6 years, and traveled around the Southwest and worked on the reservation for a little while. Worked in several rural hospitals where I would be the only healthcare provider in the facility sometimes. And I worked a year in labor and delivery. Then I came to San Juan Regional, and I worked 20 years in critical care. So after 20, and I actually flew on the flight team for a while. I ended up going to the University of Colorado, the Health Sciences Center, to a 3-year program up there. And my master's degree is in family practice. So part of my clinical rotation was here in Bloomfield. And I actually loved the Bloomfield population. I wanted to stay here. They're pretty salt-of-the-earth people that are easy to get along with and very appreciative for anything that you do for them. So it's a great patient population to be around. We take care of walk-in illnesses, same-day illnesses. We do minor suturing. We don't have an x-ray machine, but we can order x-rays from here, and people can go into Farmington and have them done. We take care of all the population's ages. We do children, infants, teenagers, adults, and gerontology here. And we can do basic labs, so urine test, strep test, those kinds of things. Mostly ear infections, sore throat, urinary tract infections. Sports physicals, we do sports physicals and DOT exams. So I'm DOT certified. Yeah, we see a lot of kids with ear infections and strep throat, coughs, bronchitis. We see people with urinary tract infections daily, and I suture 2 or 3 times a week here. I think if you're concerned, bring them in. Part of our job is to help parents make that decision whether their kids need to be on antibiotics or whether they have a virus, and what to look for in children, what to worry about in children. And if you're not in the healthcare profession, those are sometimes very difficult decisions to make. Our wait times are about 15 minutes, or sometimes as long as it takes to do the paperwork, which is about 5 minutes. One thing I think is important is our hours. So we are open Monday through Friday, but we open at 7 o'clock in the morning. And one of the reasons I think that's important is because working moms can get their kids here before they have to go to work. People can come in before school teachers, or people that have a job that starts at 8 or 9 in the morning can come in and get seen before work. And then we close at 6:30 at night, which also means parents can bring their kids in after school or after work if they need to. So that's what we're here for, is that we can take care of those same-day illnesses that you really can't wait 2 or 3 months or even 2 or 3 days. And the hours make it kind of convenient for parents and people in the workforce.